Across the globe, drug allergies are an expanding health concern. Many antibiotic allergy labels are not verified and may be incorrect. Antibiotics are overused. Broad-spectrum antibiotics are prescribed unnecessarily. Antimicrobial resistance, AMR, now causes over 33,000 deaths every year in the European Union and European Economic Area alone. Have you or someone you know been labelled as allergic to antibiotics? Could that label be incorrect? Incorrect antibiotic allergy labels affect millions, leading to more side effects, longer recovery from infections, increased healthcare costs, and worsening antimicrobial resistance. To better understand the problem and how we can solve it, let's clarify a few key terms related to antibiotic allergy and evaluation. Antibiotic allergy labels. A note in a medical record indicating allergy to a specific antibiotic. These antibiotic allergy labels can be correct or incorrect. Correct label, confirmed through proper testing. Incorrect label, added based on symptoms or assumptions, without evaluation. Allergy evaluation, detailed medical history, skin or blood tests, and, if needed, drug provocation tests to confirm or rule out the allergy. Outcomes. After evaluation, delabeling. The patient is not truly allergic. The label is removed. Confirmed allergy. Proven allergy. Identifying safe alternative drugs or desensitization strategies are used. Skin test. Small amounts of the drug placed on or under the skin to detect allergic sensitization. Drug provocation test, DPT. A controlled challenge under medical supervision with the drug to confirm or exclude allergy. Desensitization. Gradual drug dosing to build temporary tolerance under medical supervision. Antimicrobial resistance, AMR. The inability of antibiotics to treat infections due to microorganisms becoming resistant to their misuse or overuse, causing more severe illness, higher costs, and even death. We're facing a growing problem at the intersection of infectious diseases and allergic conditions. Overuse of antibiotics. Overdiagnosis of antibiotic allergy, misuse of antibiotics due to incorrect labels. Mislabeling. Avoiding first-line treatments and over-relying on second-line antibiotics. Rising antimicrobial resistance, AMR. Incorrect labels mean patients often receive less effective, more toxic, or more expensive alternatives, putting lives and public health at risk. So why does this problem persist? Lack of knowledge about allergy among patients and professionals. Many people carry unverified or outdated labels. Lack of structured allergy evaluation processes in clinical practice. In many settings, allergy testing is not part of standard care, even though it can dramatically improve treatment safety and effectiveness. The path forward is clear, but it requires action. Improve awareness of correct antibiotic use and labeling. Promote accessible, evidence-based allergy evaluations. Allocate resources to implement these protocols in real-world care. Create a collective commitment to reducing AMR through better prescribing practices. This is why EAACI is launching the Antibiotic Allergy Awareness Campaign, to inform, to empower, and to drive change.